Okay, start checklist. The item, checklist item description. One, the word case report and the area of focus should appear in the title. For example, presentation, diagnosis, surgical technique, or device or outcome. Keywords, 3 to 6 keywords that identify areas covered in this case report into case report as one of the keywords. Okay, here, introduction. What is unique or educational about this case? What does it add in the surgical literature? Why it is important? So this is introduction. And 3B, mainly these are in the abstract part. 3B, mm, the patient's main concerns and important clinical findings. 3C, the main diagnosis, therapeutic interventions and outcomes. Diagnosis, therapeutics, interventions, and outcomes. So this is also coming in abstract, and in conclusion, what are the take-away lesson of this case? Okay, introduction. A summary, a summary of why this case is unique or educational. Why this case is unique or educational with reference to the relevant surgical literature and current standard of care with references, one or two paragraphs. Nature of the institution in which the patient was managed. Okay, academic, community, or private practice setting. Patient information. The information, demographic, and other patient-specific information, including age, sex, ethnicity, occupation, and other useful patient information, BMI, and health dominance. Presentation including presenting complaint, complaint and symptoms of the patient as well as the mode of presentation. For example, brought in by ambulance or walked into emergency room, brought in by ambulance or walked into the emergency room or referred by a family physician. Past medical and surgical history and relevant outcome. Drug history, family history, including the relevant genetic information, and psychological history, including smoking, uh, relevant physical clinical findings. Describe the relevant physical examination and other significant clinical findings, include clinical photographs, where relevant, and where consent has been given. Timeline. Inclusion of the data, which allows reader to establish the sequence and order of the events in the patient's history and the presentation. Allows readers to establish the sequence and order in the patient history and presentation using a table or figure on this page. Delay from presentation to intervention should be reported. Okay. Diagnostic assistant. Diagnostic method physical laboratory testing, diagnostic challenges, access, financial, diagnostic uh, res- reasoning include other diagnosed considered, okay, prognostic characteristics when applicable, tumor staging, input relevant radiological or histopathological images in this scenario. The later may sometimes be therapeutic intervention. Pre-intervention consideration, patient optimization, measures taken prior to surgery or other interventions treating hypothermia, hypovolemia, hypertension, internal ICU care for such as dealing with anticoagulations and other medications, etc. Types of interventions: delayed and reasoning behind treatment, offered pharmacological, surgical, physiological, um, preventive, and concurrent treatment, antibiotics, treatment, antibiotics, medical devices should have manufactured and model of medical devices should have manufactured. The intervention consequence administration of intervention. What, where, when, how to return, including for surgery, anesthesia, patient position, use of tourniquet and other relevant information, pharmacological pharmacological therapy should. So this is the one just pharmacological therapy should be include combination doses, strength, routine. Okay. Who perform the procedure? Operator experience, position of the learning curve of the technique if established prior application training. Any changes in the interventions with fashionable input, interpretive photographs and videos, instruction, degree of novelty for surgical intervention and cost in human. Post-intervention consideration, post-operative instructions in case of care, follow-up outcomes, clinical assess, clinician assessed and patient-reported outcome where should be stated with inclusion of the time periods at which assessed. Relevant photographs, radiological images should provided. Improvements on measures and diagnosis and other test results. Further surveillance, revenue, imaging surveillance of the endovascular aneurysm repair, or clinical exam ultrasound where relevant interventional adherence and tolerance. However, these results diagnosis incapacitated events described in detail and ideally categorized in accordance with Cleveland classification, how they were prevented, diagnosed, and managed, blood loss, operative time, or owned complications, re-expiration duration surgery, 30 days post-operative long-term discussion. Strengths, weakness, and limitation of the approach to this case for main techniques of implants, contraindication, and alternatives, potential risk as well complications of if applicable to a large population. If relevant, has that case been reported to the relevant national agency from companies? Pharmaceutical companies for an adverse reaction to any of the discuss of the relevant literature, discussion the implication, theoretical practical guidelines, and any relevant hypothesis generation. The rationale of your conclusions. The primary take evaluations from the case report. Patient. When appropriate, the patient should share their perspective on the treatments they received. Informed consent. If the patient giving consent and consent provided by name from the team or if patient family acceptable, then document reports to trace them and who within the hospital and then document efforts to trace them and document efforts to trace them and who within the hospital is acting as the guarantor of the case report. Additional information, conflicts of interest. This is a finding, traditional review board or ethical committee.